Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, News and Public Affairs Director at WNCU, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. COVID-19 pandemic has resulted in shifts in how Medicaid workers interact with clients and where they do their work. Workers are doing their jobs from home due to social distancing requirements. And in our guest case today, she's someone who caught COVID-19. Maria Santiago is an income maintenance caseworker with the Durham Department of Social Services in Durham County here in North Carolina. Hello, Maria. How are you?
Hello, I'm good. Thanks, God.
Thank God that you're good. Thank God that I'm good too. And I just want to just welcome you to the show and just say a really big thank you for your coming on to share your information with us. It's very much appreciated.
Thank you.
Maria, for anyone out there who doesn't know, what is Medicaid?
Medicaid is federal and state program that together with the child health insurance program provide health cover for a million of Americans.
Yes, and it's not to be confused with what is it? Medicaid, Medicare.
Uh-huh.
Not to be confused with Medicare. And Medicare is health insurance for older Americans. Is that right?
That's true.
Yeah. So if people see them together, maybe they don't know what they all mean. But what do you do in your position with the Department of Social Services as a case manager?
As a case worker, yes, I have a caseload and I need to work with, and I help people to get the health insurance of Medicaid.
hmm So you deal with a whole lot of people, lots of different people. So um, pre-pandemic, just tell me what your day would be like with people coming in to actually see you.
Yes, they provide me because I work with a caseload. They provide me the documentation I request for them to bring to the office. I make copies and I have the information ready. And I I gather all the information I request from them, and they ask me question about the children, if they are doing good, and if they have cover for the entire year. And I said to them, yes, you qualify, you have everything I need, so you are free to go for the next year. I see you again.
Yes. And then and seeing them like all kinds of people, adults, children, moms, dads, what are some of the people like or who are
I just I just work with family and children. It's mama, daddy, and the children they may have. Only them. And it's in Spanish population and English population. I
so
was asking God to give me a job where I can speak more Spanish than English because my English is not that good. But thanks God, He gave me this job. I've been in this job 10 years, and praise God, I speak more Spanish than English in this job.
wonderful. So you said you've been with the Department of Social Services for 10 years.
Yes.
In those 10 years, I'm sure you have not seen anything like a pandemic, like
No.
coming and and affecting people in a way where you have to work with them to satisfy their insurance needs.
Hmm.
Um, how is it different now working in your job? Are you still in the office?
No, we shift and we start working from home. The majority of the employees from Durham County work from home, and we have our computer and our setup, and we're still doing the same job, but in our particular home.
So how did you feel when your manager said, well, we're not going to come into the office anymore. You're just gonna be at home working. How did that make you feel?
I feel blessed because of the pandemic, and I was scared, to tell you the truth. I was scared to gain the COVID, and I was praying for those people who get it. And we don't realize when was our time. And when the time came and they switched us to go to the home, I said, well, I need to manage where I gonna do this. I start in my dining table. Then I set up a little side, and I have my desk right now and the computer, and I keep working because everything is in the computer. Thanks God.
So working from home, does it really feel like work?
It feels like work, yes, but at least for me, I have birds outside and they singing, and I put my music here and I hear my music. And when the phone rings, I need to turn out the music, but at least I feel such in peace. Durham County give us the privilege to work from home, and I bless. I'm grateful for that.
Very good. How many people do you serve as a caseworker?
It all depends by month. Maybe I can have 80 cases, like I have 190 cases. It depends of the month.
So what about like with the pandemic? So you were working with a certain amount of people, and then the pandemic hit. So did the number of people that you work with increase? Did it decrease? Did it stay the same?
Well, um, in my case, because I have a setup of cases already, they divided equally to the team. We work what we have. The difference here was you don't see no more clients, you don't see no more people. You start using more your phone, and Durham County provides us with a cell phone so we can receive those calls from home, and we use that tool to communicate with them, even back and forth. I call them or they can call me.
So has that made your job more difficult, using the phone and keeping in touch and actually communicating with the people you serve?
I i don't think so. For me, I'm missing the part to be one-on-one with the people. That's true. I'm missing that part. But at the same time, I have the phone. I can call them. They can call me. And for me, it's okay. I feel good about it because one thing, we are preventing to getting COVID, vice versa. You from me, and me from you. And we are in the same environment right now, and we are doing our job the best we can. And I guess for me is faster.
It's faster.
Yeah, because I can spend with a client like 5 or 10 minutes in the phone versus in the office. Sometimes I stay with them 15 to 30 minutes from each one, and it's time consuming in that part.
And that's because of the, I guess, the interaction and the face to face.
Yeah, yeah, because when you have a client in front of you, they are talking, and we enjoy the conversation, and sometimes they go on beyond and start talking another thing, and we keep listening them, uh and we interact that way, and you don't realize already 30 minutes we want only one client.
So I want to talk to you about the people that you work with in the office. So you're not working with people anymore in the office. You're working from home. So what does that feel like? Is there an emptiness there, or are you full? How is it now that you don't interact with people that you work with or would normally work in the office with on a day-to-day basis?
Wait, I, for me particular, I feel blessed. I'm here. I'm working. I give thanks to God because He gave me the job, and I still doing it. And I probably, what can I tell you? I feel so good in here,
Or
working from home.
do you miss your friends? Do you miss your colleagues?
Yeah, we have every week we have a meeting with our supervisor, and we see each other by Teams. There's a software. The name is Teams. So we connected with them every week. So in certain point, I don't miss them because I see them, and we talk each other a little bit, but at least we updating what is going on in the agency, what is the new rule, if is there something changed or something, and our supervisor keep us update for that particular week. This is a pandemic and updating week by week.
So, talk to me now about you and your having contracted COVID-19. I know you have a personal story, and I hope you don't mind that I'm asking you about it, but I know that you did contract COVID. So, what was the circumstance around that?
Oh, girl. In January, uh, I was really good. I didn't feel nothing, and suddenly I have this cold, and I feel pain on all my body. And I said, wait a minute, I don't like this. I have the flu, and I said to my husband, oh, I have the bad flu. I feel pain everywhere. And one day passed. The second day, I feel like a worse. And I said to my husband, I don't like this. Wait a minute. Something is wrong over here. And then the pandemic was all around, and they said if you have flu, it's pretty much the same symptoms. So I get scared, and I call my doctor right away, and she sent a nurse to call me back, and she started asking me a lot of questions. And I answer them because I have a blood pressure, high blood pressure. She said to me, I need to send you to do the test. So I went, I do the test, and I have the COVID. They confirm I have the COVID. So when they said that word to me, I said, "Oh my goodness, we need to prepare. I don't know if I'm gonna die or what is going to happen over here." So my husband and I think about it, prayed about it, and I start. It's the same. It's like 2 weeks in a row. I was pretty much with the heavy, heavy cold, but didn't go nowhere more than that. Just only cold, cold. And then, like 4 days later, I said to my husband, I say, you need to do the test too, because if I have it, you must have it. And yeah, he gave the COVID too, and but he feel only go to bed and sleep. And I said, wait a minute, what is wrong over here? I have the worst part, and you sleeping? No way. So he was blessed by that because only he has was a little headache, And then the rest was sleeping. That's a grateful thing for me. But he was sleeping, and we get out from COVID. Thanks God again. Uh, and as soon as we get out with the permission of the doctor, we get vaccinated. So we both are full vaccinated.
Okay. What would you have to say to anyone who has been in the work environment and is now working from home about how to work through that kind of situation? What would be your advice?
My advice is look something you like the music. I like instrumental or worship uh, songs. So I put in my computer, I put that music and that relax me. And I hear also the birds outside. If you have you live in a house or you live in an apartment and you have birds outside, paying attention to those little things around your home, and you will see God give you the peace you need and the relaxation to do your work. Put things to do in a list and look at them, and you will in a blank of the eye you will see you did it everything.
That is wonderful advice. And I'm so glad that you and your husband both recovered from COVID, because like some stories are not written with an ending that way. So
That's true.
thank you very much for coming in to share your story. I appreciate it.
Thank you.
Yes, ma'am. And I just like to thank everybody out there for watching here on Facebook and listening to WNCU and watching on Instagram. We want you to make sure that you like us, that you follow us, and that you subscribe to our pages to see more of our archive shows. Thank you so much, Maria Santiago.
Thank you.
Thank
Thank
you.
you
I
for having
appreciate
me.
it. Yes, ma'am. I'm Kimberly Pierce Cartwright, your host for COVID Conversations, and we will see you next time.